Congressman Peter Welch, Democrat from Vermont, joins us now from Capitol Hill. Congressman, thank you for being here.
Good to be here.
You know, I've been wondering out loud, I guess to myself, perhaps not enough on television, why the urgency, and if there were such a great deal of urgency, why the president wouldn't say, everybody has to say in a special session, nobody can go on recess, I want you to work out a plan. Is that where we're headed?
No, I mean, basically, if some folks want to take extra time to get it right, that makes sense. If they want to take time basically as an excuse to kill it, that's an entirely different matter. I believe we've been fighting for health care reform for 60 years in this country, and the middle class and small businesses are the ones who have the most at stake. I mean, we have to have new rules so that if you have a pre-existing condition, you can get health care. If you get sick, you're not going to have your health care yanked away from you. We've got to stop these 30% increase in premiums that are hammering our small businesses and making them choose between hanging on to jobs or stopping the providing health care when many of them want to do it. So this is really a very important issue. Yes, it's important to get it right, but some of the folks arguing for delay are basically using it as a tactic to kill it.
Okay, but Congressman, playing devil's advocate for a moment, it doesn't appear to me as though what we've seen thus far is friendly to small business. In fact, when you talk about the taxes on health care benefits or on some of the wealthiest in this country, as you know, many of those people are the ones who file personal tax returns who happen to be small business owners. And I'm not sure I heard the president talk about small businesses last night.
Well, I know there's a focus on small business, and that's where jobs are created. But we have a lot of small businesses in Vermont. We're not a wealthy state. And our small business owners are laboring under tough economic times, and any expense is going to be a burden. That's absolutely true. But one of the major things this legislation does is focus on the cost. And in fact, the Blue Dogs, who are making a big fight on that, are doing a good thing, because we've got to make sure that we do bend the cost curve. You know, if we have health insurance going up 2 or 3 times inflation, then small businesses, whether they provide insurance or they don't, those workers who need insurance are not going to have access to it. So this effort to establish new rules in insurance, who, in my view, have been ripping off the American people. The current system works pretty good for them because they're able to jack up rates and just pass it along to businesses, to individuals, and to taxpayers. So we absolutely have to have reform. A lot of room to debate about how is the best way to do it and pay for it. And all reasonable ideas should be considered, because we do want to mitigate the impact. But we do have to have health care reform.
Congressman, I'm thrilled you're talking about small businesses. I happen to be married to a small business owner who, when he contracted out from 3 different insurers what the premiums would look like for the next year, on average, they were up about 30%. Here's my problem. I'm not sure.
It's unbelievable.
Yeah, here's my issue, though. I'm not sure that I have seen any evidence to the effect that suggests that anything we're discussing right now is friendly to small businesses. And in fact, I worry that if it's not friendlier, what you might see is more part-time employment and less full-time employment, because the costs could be too high for small businesses.
Well, you know, it's a fair question, and we've got to try to balance it out. But what we know is that the things that have to be done to bend the cost curve are going to take some time. And frankly, I don't think Congress is going to be good at micromanaging what the reimbursement rates would be. The insurance companies just don't care, because they simply pass the cost on to you and me and to your husband. What I think has to be part of this bill is, number one, empowering the Human Services Secretary to drive down some of these reforms that have improvements and reward value rather than fee-for-service-driven volume. And there's a lot of consensus on that. Accountable care organizations, bundling of payments, medical homes. That's really, really important. Secondly, the Blue Dogs had an idea that I hope they continue to hold on to, and that's to set up, in effect, a base closing commission that can take aggressive steps to contain cost in health care.
All right. Well, Congressman Welch, the story will be to continued. Thank you so much for taking the time. Appreciate it.
Thank you.